Being an older brother, I was the one following in his footsteps. I always wanted to be normal and just go out and play some basketball with him. And thank God for that. And I was able to do that. I just lived as a normal kid. Just only thing I didn't like was having to miss school to get the transfusion. Because that made me feel not so normal. But other than that, I had a great childhood, and I was blessed for that. As I stated earlier, every human life does have a timeline. Shortly after, around 2008 in college years, I kind of reached my turning point in my life. That's when I started to have pain episodes. It was very new to me, so I didn't really experience that as a child. So having to be in pain and then go to the hospital to get some sort of narcotic drug to kind of help me feel a little bit better, because honestly the drugs don't really touch the pain. It kind of really just more relaxes you and helps you cope with it until the pain finally just decides to dissipate gradually. But in all honesty, it doesn't really touch the pain. But 2008, I had a series of sickle cell crises, which often we had to go to the emergency room, sometimes at 4 a.m. because usually the pain will hit. I notice I will go to bed at normal time and then be awakened by the pain. So it'll wake me up usually around 2 a.m. and then it starts out at like a 1, and then gradually the pain will, over about a period of time, from an hour to 2 hours, it'll go from a 1 to a 10, depending on when you do start receiving some pain medication to help treat it. So in 2008, in December, I had the worst pain crisis I ever had in my life. That was, I think it hit at around December 9th. And December is a time where I'm used to spending that with my family and enjoying it. Everybody's on the Christmas spirit. You want to be home and enjoy, because it just starts to snow. So around that time, everybody likes winter at that time. But the snow, it hasn't snowed as much, so you're enjoying the snow. But having to go to the hospital, you can't really look outside and enjoy the snow. You can't be around your family, because your family will come to visit you, but it hurts them seeing you in so much pain. So, they're not going to stay 24 hours with you in the hospital. And at that time, not only did I suffer from major pain, I also couldn't breathe good. So I never even knew that could happen with having sickle cell, but that actually, I don't cry much, but that actually broke me down to the point where I was definitely shedding a lot of tears on that. But through the grace of God, I got through that. I was in the hospital about 5 days. The pain, like I said, didn't really dissipate while I was in the hospital, but they released me because I was finally able to breathe normal, fairly normal. And then I went home, and I think I had to stay in the house for around at least 2 weeks. Actually, no, it was about a week. So I did get to experience Christmas with my family, luckily. But that was a big, huge turning point in my life, 2008. I think I did have a few minor pain crisis after that until around February, where the pain crisis did subside a bit. And then that's when my life, like, God just started hitting me with all these blessings, like around early 2009. That's when I got my first full-time job with working for New York State Department of Health in the Division of Medicaid as an IT specialist. I graduated from college in late 2007. So my grandmother bought me a car for, to experience my new life as a man as I graduated. And then in the summer of 2009, that's where I met my wife now. And I see that as, that was a huge blessing from God. And then, from there on, I got engaged, and then I got married, and then now I have a baby. So I'm extremely blessed to be here, But as I said earlier, with the help of having a lot of love and support, having a support system really helps a lot. Without any type of support system, I probably wouldn't be here. So I have to thank my family and friends and all my loved ones for that. As I said earlier, every human life has a timeline. With sickle cell disease, it doesn't have to be cut short. Whether I'm feeling happy or not, I've always walked around with a smile on my face. People that know me as, I'm always smiling. But really, you don't know what's going on in my head, because the smile is on the outside, but I keep it well hidden what's really going on the inside. But having that positive attitude, I feel that helps tremendously. Because I could walk around angry all the time, because, I do have this illness that could be looked at as a disadvantage, but again, sickle cell is really like a gift and a curse. It's a gift in the way that, as I said earlier, yes, you are technically at a disadvantage, but in my eyes, you're at an advantage, because you know what it's like to suffer from hard times, experience life, having pain. So when you don't have pain, you're going to enjoy those times even more than any other person that doesn't suffer from an illness. So that's how it really is, like a gift and a curse. And that's been my experience with sickle cell so far. Any questions?
I'm just going to make a statement. I was speaking to a young man last night. He was 28 years old, and he just had a relationship split, really depressed. And one of the things you mentioned about living with sickle cell is an advantage, because living with sickle cell, you have to be courageous, you have to have endurance, you have to have persistence, you have to have strength. So all of those are the qualities that make you as a person, and that's what you're exhibiting.
Right.
The courage, the strength, the persistence, the determination.
Exactly.
And that's what I told him. I said, that's what you have to focus on, because that's what you are.
Right.
You just happen to have sickle cell.
Yeah.
But the way we see ourselves and the way you see yourself, that's going to make you the person you are. So you're just exhibiting that, and that's what we want all the young people to really appreciate, that they can be whatever they want to be.
Right. And I'm able to do a lot of things, and I meet many different people, And I just told somebody that I was speaking to that I met online that, oh yeah, I'm preparing something. I'm preparing a speech because I'm speaking tomorrow. And then he asked me, oh, what is it about? I'm like, oh, it's about sickle cell. I actually had that, but that's besides the point. So when I meet somebody, they don't even know they wouldn't even know that I have sickle cell until, I sat down with them and had to tell them. But most of the time, like, people would be very surprised to find out that I do suffer from this. So that's amazing in itself to be able to attack life with not feeling like you're at a burden with having this illness. Yes, Mother.
I'd just like to make a statement as well. I'm Shakir's mother, and I'm very proud of him, as you can imagine. And he does exemplify all the characteristics that Donette just said. And Shakir has always had a positive attitude. What he didn't tell you was that at age 3.5, he had a stroke. And that's why he had to end up having transfusion therapy. And he did, me and my husband, did our best during the young years. We would take him to the hospital, make sure that he got everything that he needed. But he did very well when he became of age. He had been paying attention, and he learned at an early age how to take care of himself and what he needed to do, and he did. He was always very compliant. He never gave us a hard time, and he was always smiling. Many times we didn't know if he was in pain because of the way he presented himself. So I just wanted to add that.
Right, and one of the reasons why I didn't speak about the stroke is because that was more of a very tough experience for my parents and my family rather than for me, because of it having been at such an early age in my life, I don't really remember that, which, that's a blessing in itself. Because if I was at 19 and I had a stroke, that would have been very hard, and I would definitely remember that now. So.
One of the positive things that I tell folks living with sickle cell is that we always stay young. You try to look at the positive, right? We age very gracefully.
Yeah, people always comment on how good my skin looks.
I still think I could sneak you into the clinic. Dr. Sells made me give you to adult land.
I have a question. I know your mom sounds like a very supportive person in your life, and your nurses and doctors. Who inspired you, as far as college and advancing? Because some of us patients don't even think of going to school and pursuing, labor, education, trade schools, or anything. In your life, do you think he was pushing you towards that direction, or was it just yourself that felt this need?
I'd say, because my mom went to college, so, when I was little, I used to look at going to college as being on your own, and, having sickle cell, you're constantly kind of being monitored. So it's kind of like, I want to do my own thing. I just want to get out there and experience life at my own pace, by myself, and just show that I can do this on my own. Like, although I appreciate all the love from my parents and my brother and everything, I think it's just good to have that, experience life on your own as an individual. So that's one of the reasons why I used to look forward to being able to go to college. Yes.
I just want to commend you on just everything that you just said, and let let you know you're a very courageous person